All right, the topic I will be presenting on is the Turing Pharmaceuticals scandal of 2015. Turing Pharmaceuticals was a company owned by Martin Shkreli. One of the drugs the company sold was Daraprim. Daraprim is a life-saving drug that treats HIV, AIDS, malaria, some cancer symptoms, and toxoplasmosis. Toxoplasmosis is a rare parasite infection that can cause serious or even life-threatening problems for babies born to women infected during pregnancy. In 2015, Turing Pharmaceuticals raised the price of Daraprim from $13.50 to $750 a pill. There's over a 5,000% increase in the price. The increase was especially surprising since the drug only cost cents to make and originally cost $1 when it was first sold. Patients usually need 2 to 3 pills a day for weeks or even months. For people with insurance, at a 20% copay, a 4-month supply of Daraprim at 2 pills per day would mean a patient pays $18,000 out of pocket. Patients were having to pay tens of thousands of dollars for a drug that they desperately needed. Due to the price increase, hospitals had a difficult time having Daraprim on stock. There are a few unfortunate results from this lack of stock. First, treatment was delayed for patients even when they urgently needed the drug. Second, patients had to be put under a review process, so they were only given the drug based off a need basis. So some of the patients were delayed even further or weren't able to receive the treatment. And third, some hospitals had to resort to alternative or experimental treatments that had unknown side effects and weren't as efficient. The Infectious Disease Society of America and the HIV Medicine Association sent a joint letter to Turing Pharmaceuticals calling the price increase of Daraprim as unjustifiable for the medically vulnerable patient population and unsustainable for the healthcare system. Even though Turing Pharmaceuticals received countless ridicule for the price increase, they didn't regret their actions or increase the drug price. Instead, Mr. Shkreli, the CEO, gave multiple justifications. He claimed the drug was so rarely used that there would be minimal impact on the healthcare system. He argued it was needed to increase profits. Shkreli even goes so far as to say the profits were being put into research on developing better treatments for toxoplasmosis with fewer side effects. Although this raised several questions with doctors and patients that wondered why a drug that had been working so well for over 60 years needed any changes at all. In addition, Turing Pharmaceuticals raged about the programs they had put in place to reduce the cost for these patients, with great financial need. So saying it can even be given to them for free if they have enough need. Shkreli believes this all to show their desire to really help patients. As Shkreli says, this isn't the greedy drug company trying to gouge patients. It is us trying to stay in business. While on the surface this may appear to be true, and that the company is truly trying to do its best, some of the company's actions seem to prove otherwise. While it's true there are programs set up by Turing to help people in financial need, it is questionable whether these programs really do much help. It is a strenuous process to actually apply for the program. The patient has to prove that they have financial need, show their health status, and even disclose all their health records, which a lot of patients, especially those who have HIV or AIDS, are really hesitant to do. The process makes it unreasonably difficult to get financial help to obtain Daraprim. Saying you have a program to help and actually having your program help are two very different things. When looking closer, Shkreli's motives seem very profit-driven, showing their company was really gouging money from patients. So there are even further consequences of this scandal. Other pharmaceutical companies have followed Turing's unethical strategy. Valiant Pharmaceuticals raised the price of its drugs Isoprel and Nitropres by 525 and 212%. In addition, a standard pack of 2 EpiPens, which are used to combat deadly allergies, was increased from $100 to $600. The CEO showed no remorse and gave the same excuses that Turing did. So she argued that it was because of the broken healthcare system and that it was needed for profit. Whether these companies actually needed to up their drug prices is the center of great controversy. But all in all, these companies seem to have fallen to corporate greed. When there is a chance to make more money, greedy corporations will jump at the chance. As long as it benefits the company, there is no concern for how it will affect innocent people. Now you might be asking, with all the backlash and upset from the drug price raises, how are pharmaceutical companies still able to take advantage of drug pricings? The answer is actually very simple. While what Turing did was unethical and immoral, it is not illegal. There's no set model for drug pricing, so companies can upcharge as much as they like, and patients have to spend way too much money. The price increase comes from a business strategy to buy old, neglected drugs and turn them into specialty drugs with higher prices. Since these pharmaceuticals are the only sellers of this drug, buyers have to spend an enormous amount of money to get it. They really have no choice. Joey Mattingly, an assistant professor of the University of Maryland School of Psychology, says, the market sort of sets up where if you need it, you have to pay for it. A for-profit entity is going to raise the price. So the for-profit entity is, for this example, is the pharmaceutical companies. These companies are driven not by a desire to help patients, but by a desire for more money. They see people simply as buyers and not as patients suffering from disability. Drug companies are even switching to controlled distributions to make sure generic companies can't get samples needed to make generic, cheaper copies. They really ensure their drug is the only option on the market. All sorts of companies are able to take advantage of a system like this. It's especially not right for pharmaceuticals who are affecting the well-being of suffering patients and putting their lives in danger. So what needs to be done? This issue shows how corporations are able to take advantage of the market and will whenever possible. But all these greedy companies are also hurting each other and themselves, because the economy cannot support so many businesses taking advantage to raise revenues. So it puts a strain on the economy and even corporate backlash from other companies. A set model needs to be put in place to regulate the price of drugs. In all business, too, there should be models put in place to regulate business structure, because when big companies take advantage of innocent people who are unable to do anything about it, it is simply not right.